me. My name is Linda Mai. I'm the current publicist. So I just want to start off to tell y'all why I want to be Vice President of Patient Care. So it started off last year during annual. I went to Orlando with a bunch of P2s. It was just me as a P1 and Puri. And so just going, I had no idea what to expect, but I knew my goal was to go to a convention every year. And so I went, it blew my mind. You see students everywhere across the nation showcasing pretty much what they do in their APHA chapter. And so I know a lot of y'all, like, it says APHA, but it's APHA ASP. I don't know if y'all know what ASP stands for, but it's Academy of Student Pharmacists. So we are student pharmacists. So when I went, I was inspired. They go everywhere across their state and bring patient care to their community. There were chapters where they went in one day, went through the whole state and brought patient care. I mean, we can't do that. Texas is humongous. But maybe just, through Houston, we can go around all the different communities that they have and bring patient care, because that's a big thing. Why did we go into pharmacy? To help patients. I know that's what they tell you not to say, but that's true. We came to help patients. I mean, we lose that spark in the beginning of the school year. You come in as a P1, you're so bright-eyed, bushy-tailed about, helping others. Then throughout this year, throughout the semester, you kind of just lose that spark, that passion for being a pharmacist. So by going to annual, I was able to see that passion, and it was able to encourage me to do more. And after speaking with Sarah, because I know this position will demand a lot from me, because pretty much I'll be over all the initiatives. So if you don't have a big idea about the initiatives, it's just we have Operation Heart, Operation Immunization, Operation Diabetes, Generation RX, IPSF, Operation Self-Care. There's just so much we can do. And so in this position, what I would want to do is help spark that enthusiasm again and keep it alive throughout the whole year. I know it's really hard. I mean, don't get me wrong, I do forget about that passion at times because school is very demanding. But what I want to do is just keep that spark alive and go out and help the community. That's what we're meant to do, right? That's why we went into pharmacy, to help our community. So, I'm sorry. So after that, so the things that I want to do besides just keeping that spark alive, is just one idea I had, maybe over the summer, because I know we're really busy. I had this idea last year was to go to different companies and do humongous health fairs there. Because I know at my dad's company, they have picnics with all their employees, and maybe we can go out there and showcase what we do as student pharmacists, help with their glucose, help with control their diabetes, and teach them what they can do to get the best out of their drug therapy. And so, like I said before, this position is very demanding, and so as publicist, I was able to actually work with a lot of the operations. I know as a publicist, a lot of it is just to keep track of Facebook, but I actually had a chance to work with Generation RX over the summer and help create their video. And just working with them and seeing what they do and their mission pretty much is inspiring, as well as work with all the other initiatives, just with their little projects with IPSF, as simple as making a flyer to go to Pluckers. So they do a lot, and I've worked with almost every single one of these operations, and I know it's a lot of work for each one of them, and if I can just help them help that load that they have, then I'll be that go-to person for them. Yeah, if you could just consider me and vote for me for next year's Vice President of Patient Care.
Got about 30 seconds. Do y'all have a question? Maybe I have a question. Okay. That's not. Thank you very much, Linda.